Can acupuncture or dry needling help for muscle or tendon pain? And the short answer is yes, it can. In some cases, it can be surprisingly effective. First off, let's talk about acupuncture, because it's more than just sticking needles into the painful stuff. There's a whole TCM, traditional Chinese medicine system, involving a detailed patient history, a pulse exam, and a tongue exam to give a TCM diagnosis, something like a damp spleen. And then once you have the diagnosis, you can determine the best acupuncture points to use to address that diagnosis. And of course, also there's just some commonly used points for common issues. But I don't really want to dive into traditional Chinese medicine. I want to talk about putting needles, right into the painful bits. Hurts there, we're going to put there. We're not dealing with the acupuncture points. We're not dealing with the meridians. We're not dealing with the traditional Chinese medicine diagnosis system. Now, the term dry needling means to use the needles dry because there is nothing being injected. There's no fluid involved, so they are dry needles. Acupuncture needles are used normally, and there's thicker and thinner ones. They can be longer or shorter. They can be Chinese or Japanese. In fact, the Sarin Japanese needles are, in my opinion, by far the best. They tend to be thinner than what most people would consider a needle. In fact, you could put an acupuncture needle within a common injection needle or a blood draw needle. They are much thinner. And they can be thinner because they're just a solid piece of steel instead of a tube. Another consequence of that is instead of cutting a hole through the skin, it seems like they almost like parts the skin, because it's very rare after I remove the needle that there's even a single drop of blood, maybe 1 out of every 10 needles, maybe. And if you're staring at the arm or staring at the back, you can stare and you really have a hard time seeing, where those needles were. Here, let me demonstrate on my arm. So I used an alcohol swab to prep the area, and I'll just pick a muscle to jam this needle into. So there's a tube that helps to guide it, and I just pick it and poke. I didn't even feel that go in. Sometimes people feel a little pinch or pin prick, and you don't want to be moving the muscles around when the needle's in, and I can stick that in just a little bit deeper there. And so that's it there. Right? Just in the skin. It's like a mosquito bite. I actually don't feel this at all. And if I take this out, where is that needle? You can't see it. Now, which painful bits should you be putting these needles into? Well, you can start by putting them into tight muscles, like the muscles along the spine or the top of the shoulder. And if you do that, the muscles relax. Now, some of those muscles, yes, you can stretch out or use a hot pack, but in particular, I find like between the ribs and the spine, like you can't really stretch out those muscles, and they're painful to massage. Needles like win hands down. Yes, you have to be careful as a practitioner. You don't want to stab someone in the lungs. That's no good. But for how effective they are at relaxing muscles, it's just fantastic. You stick muscles in, you pull them out 5-10 minutes later, and the muscles are relaxed. Now, another muscle issue that the needles help with greatly is those nasty muscle knots. The nasty muscle knots called myofascial trigger points, MFTPs. If you stick a needle into one of them, you pull it out 3 minutes later, 5 minutes later, and you'll find that it'll be smaller. And if you do it on subsequent sessions, it'll get smaller and smaller. So my preferred treatment is ischemic compression, where you push on the muscle knot until you're basically depriving of blood, and until you feel the pain and tension go down, you go deeper, pain goes back up, you wait for pain to drop, you go deeper. Except that takes a long time. And you can imagine if there's 10 muscle knots, doing that one after another, spending like half an hour of that, or just sticking needles in all of them, waiting 5-10 minutes, taking all the needles out, a lot easier on the practitioner's hands, a lot less pain for the patient, because once the needles are there, maybe a sense of pressure, but aside from that, the needles are painless. So it can be, particularly if there's a lot going on, I love to use needles just to save the patient pain, and we can get progress on all these muscle knots at the same time. Or I could work on muscle knots in the calf, I could do ischemic compression in the shoulder, and just use my time more wisely. It's just an option for these myofascial trigger points, even though ischemic compression I think is better. The needles do work, and there's a lot of practitioners that use needles. I'm not necessarily saying they're lazy, but it's a good option, and it does help. Sometimes it takes a bit more sessions than the ischemic compression, in my opinion, assuming there's not too many. If there's a lot, it actually does help you get more done faster, more done in a single session. For a month, I did an experiment. I treat a lot of women for headaches. At one time, over 50% of my patients were headache patients, and a lot of them are connected to myofascial trigger points in the shoulders. So for a month, I did needling in just one half and compression in the other half. And the result was, at the end of the month, every single patient said both sides felt better. Almost every single patient said, hey, if you don't mind, could you do the compression on the needle side, please? So that confirms that the ischemic compression works better. Now, where I found that needles work better than compression is sometimes in the forearm. Sometimes I'm really struggling to get the muscle knots to disappear there, and there's often big muscle knot bands. And I've found that needling, although they're thin bands, they're hard to hit, but if I hit them, needles seem to work better, as good or better than ischemic compression in the forearm. So maybe it's region dependent, maybe it's practitioner dependent. Maybe I'm better in the forearm and I'm not as good at using the needles in the shoulders. And maybe I'm really good at using ischemic compression in the shoulders and I'm not as good at using ischemic compression in the forearm. So there's that aspect there. But end of the story is that needles do help for myofascial trigger points wherever they are. You stick the needle in, and then the myofascial trigger point will be smaller afterwards. Now, a tendinosis is a chronic, deconditioned, weakened, swollen, and tender tendon. This is often misdiagnosed as a chronic tendonitis or bursitis. So for all intents and purposes, when I'm talking about tendinosis, I'm also talking about tendonitis, tennis elbow, golfer's elbow, epicondylitis, Achilles tendonitis, pes anserine, bursitis or tendonitis, or syndrome, greater trochanter, bursitis, impingement syndrome, rotator cuff tendonitis, etc. Needles are effective at helping to heal these sickly tendons. A tendinosis, it's a bit of a mismatch between sort of the body's upkeep and wear and tear. For some people, it's more wear and tear. For some people, it's more on the lack of upkeep. So it's sort of like the body's like, you don't really use that tendon. Why bother wasting resources, like maintaining it, getting it all the way back up to 100% strength? You don't even use it. So it sort of lingers at this sort of half-healed intermediate state that's swollen and painful and tender. And it seems like needles are effective at maybe helping jumpstart the healing process, the maintenance process, so you can get back to full strength. Of course, exercises are the go-to because the tenocytes, they respond to force. You put a force on the tenocytes, the cells that maintain the tendon, and they're like, oh wow, I'm being used. I better get working, better start reconditioning this tendon, making sure it's as strong as I can make it. So exercises are the go-to, but needles can help. Needles are almost as good as PRP injections, platelet-rich plasma injections. That's what PRP stands for. Similar results to prolotherapy, that's a dextrose injection, and better results than cortisone. I'll take a moment to point out that cortisone, in particular, it's not curative. It's only pain relieving, and it can even impede the healing process for tendons, and it's not recommended to inject cortisone into tendons for that reason. Now, there's an extreme version of dry needling called fenestration, where they use a very large needle, and they basically, it's often a normal type injection type needle, so it's a tube, and they cut giant holes, big holes, all through the tendon, try to destroy basically 50% of it. The thought is, well, it's not really healing the way it is, so let's just destroy it, and then the body has to fix it now. And hopefully when it fixes it, it does a better job fixing it. Luckily, it seems like that's overkill, although there could be more research. There can always be more research, but it seems like dry needling with acupuncture needles works about as well. So you don't need to destroy the tendon. Just sticking in these basically painless needles seems to do the trick. Now, the needles can be guided via ultrasound imaging for even more precise placement. Sometimes the exercises stop working because half the tendon is healed, so the healed tendon fibers are the ones experiencing the exercise, and the sickly fibers don't feel it. With the needles, you can get right into the problem region. Now, why does it work? Needles do seem to change local blood flow and local chemical transmitters, but the exact mechanism is not well understood. And frankly, it doesn't really matter to me how it works as long as it helps my patients. Needles are a useful tool in the toolbox, but they're not the only tool. They help, but consider other treatments to help prevent chronic issues from returning or to help speed up the healing process. And for both of those, my go-to would be exercises. Maybe there's a muscle imbalance, there's a muscle you're not using, so one muscle has to be tight all the time because it's making up for the fact you're not using another muscle. And the way out of that cycle is to strengthen or get your brain to start using the muscle that has not been used in a while. And basically activate that and correct faulty recruitment patterns. For tendons, it's using the tendon and gain some force through that tendon, and that can cause the tenocytes to start remodeling the tendon. So it's a tool, but not the only tool. So I advise you to use all the tools at your disposal to get out of pain and to get out of a cycle of chronic pain. I hope you found this useful. Cheers.